On this episode of When Does It End? We will focus on HIV disparities within Black communities. During our conversation, we will explore the constructs needed to promote healthier living for Black people in America. Our hosts, Tori and Chris, will talk with community members who have been game changers in ending HIV-related disparities for Black people, highlighting the needs for systematic and structural changes in systems, services, and programs that create health barriers for Black people. Our host and guests will plan to take you on a journey of insight that is aimed to inspire change, encouraging you to liberate yourself and informing you that Black lives do matter. What's up? What's up? What's up? It's Chris, and we are bringing you yet another exciting topic in our journey to ending the HIV epidemic in America. In today's episode, we are going back to our roots and talking all things Black, reviewing some key points in history, current pop culture, and the roles that race play in the HIV epidemic. Being, living, and growing up as a Black man, I have seen, felt, and heard of an inequity due to the race within my life. From being raised in a home to where college was viewed as a dream and not an option, to understanding that Black people are more susceptible to HIV transmission than other races, given the social determinants of health. Today's conversation, we will talk about the institutional systems that create barriers for Black people and provide you all with some key takeaways that you can use to fight these systems within your community.
So thank you so much, Chris. And thanks again, everybody, for joining us today. Kin folks, skin folks, and all folks. And yes to everything that you just said, Chris. So as a Black transgender woman, I can attest to the inequity in regards to race, in regards to gender, and perceived social status. It would be impossible for us to really talk about ending the epidemic without addressing some of the issues that continually feed the epidemic even after 40 years. And the further you are away from that fake archetype of perfection, the more obstacles that you will have to face in society. Don't believe me? Well, according to AmericanProgress.org, white women make an average of 20% less than men for doing the exact same work. Black women earn 40% less, and Hispanic women earn nearly 50% less. Now, don't get me wrong, I'm not blaming the HIV epidemic on white men. I happen to love white men. I love everybody. The latest census numbers prove that our country has changed dramatically in terms of race and in terms of ethnicity, demographics, and location. So as a Black woman, my needs and folks like Chris and I have to be included in the solution, and they cannot be just told to take a pill.
And when we talk about systems, for me, one of the biggest systems that have impacted communities of color when it comes to HIV transmission is the media. For years, Black people have asked for more effective and true representation. And today we can see Black people in films, on TV, directing, writing, and producing content that is authentic to the Black struggle within American society. Recently, one of my favorite TV reality shows, Married to Medicine, that showcases the lives of Black doctors and their families, gave us something new. They showcase Black people doing amazing things within their lives, within the community, by showcasing and standing up at a major protest within DC. Traditionally, Black people in film were cast as to help or in supporting roles. But today we stand up as problem solvers and the solutions to many of the problems, as the clip will show you as a prime example. I love having the ability to be able to share my own narrative from my own perspective and not from the perspective of someone who doesn't look the way that I do. We finally operate in spaces where it is acceptable to publicly talk about the Black experience in America without being cast as racist, bigots, or victims. This new wave of tech, social media, and collective power has created an atmosphere in which Black people finally have a voice that reaches those inside and external to our communities.
People everywhere, every direction, as far as you can see.
God bless you. We are here today to make history.
And if we move forward with purpose and passion, 1960s.
Chris, tell us a little more. How has the racial reckoning that we're experiencing today impacted the culture of HIV?
Tori, I honestly think that it all boils down to controlling the narrative. During the first 30 years of the HIV epidemic, you had people not affected by HIV controlling the narratives and media focused on those living with HIV and most vulnerable. When I look back at political cartoons from the 80s and the 90s about HIV, there were two common things I viewed as a consistent narrative. One, HIV was a gay-only thing, and two, Black people were the cause. Disparaging misinformation such as this has gone on for years and has created a culture that singles out both queer and Black people when it comes to the HIV epidemic and associated discrimination and disparity within America. Because white people of the time had access to medical care and treatment that Black people didn't have, they'd had institutional knowledge and power that created opportunities for them to live healthier lives that Black people didn't have. A favorite show of mine entitled Pose on FX recently tackled this issue in the scene. In this one scene, two of the main characters, Praytel and Blanca Evangelista, are both living with HIV. While managing their diagnosis in New York during the late 1980s, they received information about a research study being conducted around modern day ART. And for those of you who don't know what ART is, ART stands for antiretroviral therapy, which is a medication that people living with HIV take on a daily basis to become virally suppressed. And remember, y'all, undetectable equals what? Untransmittable. But back to this episode. And in this episode, they have to fight tooth and nail to be included in this research study where these new life-saving medications were being tested. Creating spaces where Black people feel like they belong has been a journey. And today I'm glad to say that we are finally getting somewhere. The Black Lives Matter movement was started back in 2013 after three radical Black organizers, Alicia Garza, Patrice Coyers, and Opal Tometi, came together to create a Black-centered political movement in response to the acquittal of Trayvon Martin's murderer, George Zimmerman, with the goal of dismantling the hierarchies of Black liberation movements of the past. The Black Lives Matter movement is focused on centering the voices of everyday people, with the focus on centering the leadership of women, queer, and people of trans experience. Check out this video to learn more about the Black Lives Matter movement today.
What started as a hashtag in 2013 went from trending on social media to becoming one of the largest movements in American history. Black Lives Matter started with a Facebook post by one of its founders, Alicia Garza. Her post, entitled "A Love Letter to Black People," was a dedication to the Black community after the acquittal of George Zimmerman in the killing of 17-year-old Trayvon Martin. She ended with the words, "Black people, I love you, I love us, our lives matter." Garza and her friends Patrice Cullors and Opal Tometi coined the hashtag Black Lives Matter later that year. As the hashtag's popularity grew, so did backlash with the rise of White Lives and All Lives Matter groups. The number of Black victims of police brutality also grew, making the slogan increasingly important. In 2014, the deaths of Tamir Rice, Eric Garner, and Michael Brown ignited the movement and protests nationwide. But it was the death of Michelle Clouseau that same year that began Say Her Name, a subsection of the Black Lives Matter movement that focuses on Black women who have lost their lives to police violence. It quickly rose in popularity and was used in protests for the deaths of Sandra Bland and then Breonna Taylor. In 2019, places where BLM protests occurred had a 20% decrease in killings by police. Local protests also increased the amount of police body cams and community policing initiatives. In 2020, as many as 26 million people participated in demonstrations protesting the killing of George Floyd. By the end of the year, Black Lives Matter raised $90 million, which went to expenses like crisis intervention, civic engagement, and grassroots funding. The killing of George Floyd also changed the demographics of support towards Black Lives Matter. Nearly 95% of the protests happened in majority white counties. Today, there are 3 entities of Black Lives Matter, including the nonprofit BLM Global Network Foundation, which committed $21.7 million in grant funding to official and unofficial BLM chapters, as well as 30 Black-led local organizations. But despite the organization's success, family members of Tamir Rice and Michael Brown have spoken out against Black Lives Matter for profiting off the police killings of their relatives. and some have questioned where financial contributions go. Still, the mission of Black Lives Matter remains straightforward, and as it's grown, so has its impact. Black Lives Matter members in Los Angeles successfully fought for the firing of ex-LAPD Police Chief Charlie Beck after they saw a rise in police shootings of Black suspects in the area. In 2020, Black Lives Matter received more media coverage than any protest in 50 years, and the hashtag was shared more than 100 million times in the month after George Floyd was killed. Within weeks of the 2020 protests, Louisville, Kentucky banned no-knock warrants, Minneapolis banned chokeholds, and major cities made budget cuts to their police departments, including Los Angeles and New York City.
Acknowledging the trauma faced by people within marginalized communities, the Black Lives Matter movement has become a global network of more than 40 chapters actively fighting for institutional change. The Black Lives Matter has propelled conversations around state-sanctioned violence, with the mission to eradicate white supremacy and build local power to intervene in violence inflicted on Black communities by the state and vigilantes of the Black Lives Matter movement, combats and counteracts of violence while creating spaces for the imagination and innovation of all Black people while centering Black joy and creating improvements for the embetterment of the Black community.
Black Lives Matter movement has been a catalyst of change. I'd also add that the Black Trans Lives Matter movement, founded in part by Milan Sherry out of New Orleans. We are forever grateful to these ladies for their vision and to everyone who's ever believed and supported those visions. In 2020, over 15,000 trans and non-binary folks and supporters attended the Black Trans Lives Matter rally, also known as Brooklyn Liberation. To date, this is one of the largest trans and gender expansive focused protests in history. In an ABC News article, Ms. Genovia Chase, who is co-lead organizer of the House Lives Matter movement, is quoted as saying, "We are a prime target because of our Blackness, and our intersectionality of being trans adds an extra target on our backs." In Los Angeles, tens of thousands gathered in Hollywood for the All Black Lives Matter protests, intended to be inclusive and centered on LGBTQ members of BLM. A 2020 article by Devin Norrell by Teen Vogue titled, "The Black Lives Matter Movement Must Include Trans People" reads in part, "What comes first, our Blackness or our queer transness? While all Black people face state-sanctioned racism, queer and trans people are even more exposed to violence of white supremacy. Not just that, but queer and trans Black people are also subject to violence from the Black community." So when we say Black Lives Matter, are we also talking about all Black people? Look, Chris and I love and support Black Lives Matter, and our guests love and support Black Lives Matter. But we must have more intentional inclusion that incorporates all Black lives. And you may ask, what does this have to do with ending the HIV epidemic? Well, the same state-sanctioned racism fuels health disparities. It fuels fewer economic opportunities and far worse inequities in health and in wealth. These are some of the things that we refer to as the social determinants of health.
And we also need to remember that all Black lives matter within the HIV transmission and the fight to end the HIV epidemic in America. So if you look at our screen, you can see that there are more than just Tori and I. We have two amazing, beautiful, and Black professionals with us today. So if you could please unmute yourselves and tell the people who you are, where you're from, and what do you do?
Sure, I'll go first. My name is Michael Everett, and I'm a senior research associate at ETR and Associates, which is a nonprofit organization committed to improving health outcomes and advancing health equity for youth, families, and communities. I also have an LLC that allows me to do stuff that the nonprofit work doesn't allow me to do, which is work in the communities that I want to work in. And it's mostly about relationship building with people of color, and it's called Intimacy in Color because it's about bringing intimacy into the communities of color and into the work that we do with communities of color as well.
Hey everyone, my name is Park, I am a 30-year-old elected official in Atlanta, Georgia, where we know the HIV epidemic has had a stronghold on so many communities. That's why I recently got my labor doula certification so that I can help expecting families when they are in the hospital setting, the home birth setting, or the birth center setting to understand that stigma has no place in healthcare.
Awesome. As you can see, ladies and gentlemen, we have some amazing people with some extensive resumes in the conversation today. And so we're just gonna hop right into it. So when we talk about ending the HIV epidemic in America, we talk about a lot of things, but specifically from your perspective, what does it mean to truly end the HIV epidemic within Black communities?
Sure, I'll start. And I would say that I guess for me, it means that Black communities will need an active role in determining what happens in their communities. I think the issue has been that Black communities have been allowed to partake in their own health, right, via community-based organizations and health departments and CDC and other places, but not really had the same kind of agency as maybe other groups in terms of determining that. So I think ending it means giving true agency to Black people to decide what ending it looks like, and also elevating them in the positions that they work and exist in, and not just having them at frontline roles within organizations to be able to determine that for themselves. So I think ending it is about giving them the power, and not just giving it, letting them express the power to be able to do those things, the things that we already know that Black folks can and have proven that they can do.
I so agree with you in that perspective, because ending the HIV epidemic here to us in Atlanta, Georgia, it's everything. When we look outside, we see billboards requesting that people get tested, but we know that there has been stigma. And for us, we want to be clear that if we are able to truly engage with communities, compensate people for their lived experiences, and elevate them to positions where they will be able to make strong decisions without having to regress or feel as though they don't have the statistics to back up the qualitative information that they're bringing, then we'll actually be able to get through stigma. It means everything to my staff and my team members and my community, the hospitals that I work in as well.
So while we have you, Representative Kennan, let me ask you a question. What role do you think specifically does Black leadership have in ending the HIV epidemic?
For example, here in Georgia, we have the largest Black caucus of state elected officials in the United States. However, stigma rests in the conversations that are had when we engage with Black leaders, but we don't actually have information for them to purport and report forward that talks about lived experience. We know that we're in the Bible Belt. So sometimes just because you're Black, it does not mean that you speak to the nuance or you actually believe in the intersectionality. At times, instead, you might try to do things that distance you from the community or say things that change people's perspective on whether they can really call you a credible messenger. So what role do I really believe that Black people and Black elected officials in the South have? I believe that we have the power to put policy forward that diminishes stigma, that changes testing protocols, and that stands with community when we say this provider is not competent or that community resource needs more support.
And Michael, you said something earlier that really struck me. You talked about being able to create spaces to where Black people have the agency. Could you describe or give us an enhanced description on your definition of Black agency? And how can we create that and establish that? And once it's created, how can we keep that?
It's super complicated because we live in America and we know that our systems are riddled with institutional racism. And while we know that it exists, and I think particularly over the last 20 years, there's a general understanding that it exists, and there's not a lot of pushback on that from the folks who we are listening to, that there's not anything done about it that I think makes us feel better, that sort of helps with our mental state around it. And so what you have is a bunch of leaders, and I'm talking about in community-based organizations with HIV organizations specifically, a bunch of leaders who are running organizations that they inherited from other people. But a lot of this inheritance is about working out of crises and not out of strategy, right? And so what we have are people who are still from the very 80s trying to stop HIV and AIDS from happening and not having a moment to be like, well, how do I build an institution? How do I build an organization? How do I write grants? How do I teach other people to do the same? And how do I become sustainable? The other thing is that we apply for money that people tell us to apply for. So that's part of the trap, right? The thing about applying for money is that you have to have a strategy with it. It's got to be aligned with your values already, or else the money will become your values. And I think that's another thing that happens, right? Is that we get tied to these things, to these contracts that look like we're trying to do the most good for our communities, and we end up not doing the most good because we're not being honest around what the intent is and sort of what the expectation is. So all of that can get super messy, but that is to say is that we've got, and I mean leaders and Black leaders, and this I think goes to that last question. Black leaders have got to sort of stand up and push back on institutional racism, push back on the inheritance that we got from organizations. And we have to be okay with starting over. And I think that, and starting on our own, starting with our own ideals, building institutions that are going to do the most good for us. So agency means creating it for yourself. And I don't think that we have that. I think we get lured into these positions. Like maybe, I know I started 20 years ago as an HIV outreach worker, right? Doing workshops at schools. And I was not thinking that this was going to be my career, right? But then every year I kept moving up, and it just happened, right? And it wasn't like I was a person who was infected with HIV, but I was a person affected by HIV, and that was my motivation for going. I had plans on being an attorney. That was the goal, right? And somehow all of that became different because my skills shined in this space. But what I saw was opportunity to liberate particularly Black communities in the work that they were doing, the way that they were doing HIV work. And that's why I started my own company, to say that, hey, you can work in the system, but I think if you really want to do stuff with your own agency, you got to create it for yourself, and you got to be unapologetic about creating that. So that's what I mean by agency.
So I love all of that, Michael, and I'm here for it. And I would snap and snap and snap, but I need a manicure so people don't need to see my nails. But since you keep mentioning systems, I do want to ask you this. Can you give us a couple of very specific things, how systems and services and programs can be designed to end the HIV epidemic, specifically in relation to disparities, those things that we call the social determinants of health within Black communities?
That's a big question. First thing that comes to my mind is that we have to start having the same conversations around sexual health and social health as if they exist together, because they do. It's not just sexual health where sex is happening in isolation, disease is happening. No, that our social systems are really evidence of all of the other things that are impacting us, right? And so we have to deal with these things together. So that's sort of one. In terms of systems change, I think you have to have an ecological approach, and anybody who knows me knows that I'm a big fan of this. That you can talk to an individual, but with an individual, you have to change their knowledge, you have to give them skills, and you have to change their attitudes, which is an efficacy thing, right? That means you have to be well-versed in psychology and sociology and sort of all this other stuff to be doing, and that's just for an individual. But that doesn't sustain change. That just helps one person decide one thing. If you're disciplined enough, you can maintain that, right? Some people can quit smoking cigarettes, some people need a whole process for that to happen. Now, other folks are going to need support with their relations. So like, I know that the house that I grew up in, if I'm trying to lose weight, my mom is doing all the cooking. Well, that's what my diet is, because she's doing all the cooking, right? So if that's the relationship, then the way to change that is to educate my mother and my family around food so that I can then get the resources I need, and the support that I need to do that. The third thing is then your community, because you can stay in your house and you can be in your head, but you still exist inside of a community that may or may not want you, that may or may not love you and respect you. We have to create safe spaces. I'm tired of saying community, and when we talk about LGBT folks living in Black communities, without talking about how we get rid of homophobia. We can't just say that it exists. We have to talk about how to get rid of those things specifically, tangibly, in places of worship, in places, particularly in schools and places where public dollars are certainly being used. And I don't think there's enough work being done around that particular thing. And the last part of that ecological framework is policy. if Black folks particularly aren't connected or don't understand the policies that exist that are driving their communities, don't understand how to create them, don't know how to write laws, don't know how to run positions, don't know how to support other people who are doing this, then we won't have all the resources that are possible to sort of make the best effort that we can. So I think that the strategy is about taking an approach. Everybody can do something. Can you work with individuals? Can you work with families? Can you work with communities? Can you work with policies? And if we can do those things together and align our goals, I think that we stand a better chance at navigating HIV and all of the issues, the plethora of issues that impact communities of color.
And so actually, you actually kind of answered or alluded to an answer that responds to my next question, because my next question was, what's missing from the EHE initiative, EHE standing for Ending the HIV Epidemic, that will be helpful for the Black community? And if you're watching and you are not aware of what EHE is the American government's plan to really end the HIV epidemic within America by 2030 through the 4 pillars, which are prevention, diagnosing, treatment, and responding. And Michael, something that you just said kind of answered that question for me. You said that giving people the agency to figure out where you align and where you fit, and acknowledging that like you just can't stay in this one place and get this one thing done, but you have to work with people. You have to be willing to think, pair, and share your knowledge around the community to be able to see an effective change. So I just can't sit within one pillar of treatment and expect there to be change. I just can't want to sit here and diagnose people and not expect people to want to respond. So I think that you really answered that for me. Like within our Black community, I think we need to figure out where our niche is. You said it yourself, like you grew up wanting to be a lawyer, but you got into this public health space, and year by year, you steadily advanced, and you kept growing because of your skill set and what you had the ability to be able to bring to the table. And that's the vein that you sit in. And you are aware of that, but you're also willing to share your knowledge with other people who may be versed in areas outside of your own. So even in my list of questions, when it comes to what could be helpful to end the HIV epidemic or what can be established with the EHE initiative within the Black community, I think it's about acknowledging what your skill set is and being willing to learn and to share that with people outside of your own space or atmosphere.
Yes to all of that. Yes to all of that. So because you said that, you actually brought up a couple of things that I want to hear from first you, Michael, because you're hot on the mic right now, and then Representative Cannon, because she is always hot on the mic. I would love to hear about a couple of things that each of you is witnessing that's successfully engaging Black communities in HIV prevention and care. We know PrEP works. And we know PrEP modalities work because there's more than one type of PrEP now. And that's really, really important. And Chris and I can talk a little bit more about that if folks have any questions. But I'd love to hear first from you, Michael, and then from you, Representative Cannon, about a couple of things that are successfully being done right now for Black people, specifically Black people in terms of HIV prevention and care.
I'll say we know that PrEP works. I think we also know that the conversations for PrEP, like the rollout of that initially was not done well, right? And so we have not done well with engaging communities around their health and around things we're asking them to do, that there can be a road to transparency that I think builds confidence, both in the folks who are educating and the folks who are being educated. So that's sort of one. Here's the strategy that I'll list that I think gets ignored often. We already know that syringe exchange works. We know that harm reduction works. We know that those programs work, right? And we've seen the great work that is happening in communities that have embraced those ideas. I think Florida is a big example of a group that didn't have a syringe exchange and now does. And I was just visiting one a few weeks ago, and it was primarily communities of color. They're supporting each other with wraparound services, but it was just amazing how the number one theme was that they just didn't have dignity. Nobody was giving them dignity and services, and that's why this thing works. So what I know about giving folks dignity is that it's not required, right? It's not required unless the boss is requiring it, unless the policy is requiring it. And so dignity has to be a choice that we all make. And if it's not the highest standard, then it becomes hard. So yeah, we can do these other strategies, but like I said, if we're not being good to people, then what good is a PrEP solution that works if we're not good to people when talking to them about it, if it's not their choice, if it's not they're being empowered to make a decision around it. So I'd say harm reduction and syringe programs works. PrEP definitely works. Condom distribution works, but the conversations we can get better with.
And that's what's so interesting. I would agree as well, because at the end of the day, culture has to be a part of our solutions. If you are inviting people to an event for testing, we might need to have some food beyond chips and water. We might need to actually hear people when they say that they're hungry, or take those nonverbal cues of what seem to maybe be hesitation to actually just be an unmet need. So there are organizations here in Atlanta, and I've got to shout out, because one of our groups recently has been doing it for the culture, having their meetings, behind the scenes, getting together and talking and supporting each other. And they finally were recognized by Lil Nas X. He put them on his list of organizations to support as he put out his new album. Now, regardless of if that is the music of choice for the listeners or for the people who are putting on the event, they need to understand there might be an association of positivity that someone might feel if they hear some music playing in the background. It will jog those positive memories. And as a healthcare provider, I know that we are always trying to increase the love hormone. We're always trying to increase the positive hormones that go through people's bodies when they're being tested or surveilled in any way, whether it's a blood pressure cuff going on or a syringe. People need to be able to feel as relaxed, seen, and heard as possible. And so I think that these are some of the strategies that don't actually take too much to do. In fact, it almost takes time stepping back. I remember growing up, sometimes my family would joke with me and they would say, "You know all the language, you're so book smart, but where are your street smarts, girl?" And sometimes I think that our organizations become so budgetary and documenting and all of these different categories that the category is really human love, affection, engagement and enjoyment as we get through these difficult times of not just the HIV pandemic, but also the COVID-19 pandemic.
That particular organization is Thrive SS in Atlanta that you just mentioned, and shout out to them because they're doing a lot of great work. And what you also represented for us is the impact of media. The impact of media and Black lives. Lil Nas X is the Black man from Atlanta who shouted out a traditionally Black run and Black serving organization out of Atlanta, and the impact that has. He's showing that Black lives who are living with HIV matter also. So thank you so much for mentioning that, Representative Cannon. And thank you to Thrive SS for all the amazing work you guys are doing. We appreciate you. Chris?
And so, one, thank you both for your responses. And so they all go back to something that I've been thinking about and pondering about the last few weeks. So I was recently talking to a client of mine in a focus group, and we were talking about PrEP. And they said, everybody knows about PrEP, and it's not the PrEP, it's the issue, it's the process, right? And so I started to think, everybody knows about harm reduction techniques. Everybody knows about PrEP, people know about condoms, but what's missing is the connection of the process, and for people to be seen as people and not as a statistic and not as a number. And both of you alluded to the fact, like the true nature of reaching people to really end the HIV epidemic in America needs to start with love. And love needs to be a part of that process. Human-centered approach needs to be a part of that process. Attacking the social determinants of health so people can have the resources to get accessible and equitable health care they need to sustain healthier ways of living is a part of that process. And we know that historically, being Black, we have been left out of the establishment of the process. And so with that being said, we know that Black people make up 13% of the total population of the US and its dependent areas. Black people account for the highest rate of HIV infections. How can gaining a deeper understanding of the Black community help us end the HIV epidemic within the US?
You said understanding, a deeper understanding of the Black community. I think it's an understanding of the Black community, right? Like, it's amazing to me with everything that's been going on over the last few years, particularly, that folks are realizing like what Black folks' experiences have been, or like just on the daily. And I think that's been part of the frustration for those of us who are in the workforce, particularly in organizations, like I said, where they're primarily non-BIPOC and Black folks, that you got to watch other folks, primarily white folks, respond to the stuff that's happening, and whether those responses have been satisfactory or not. I know they've been frustrating for me, and it's felt like a lot of emotional labor, while still doing my job, and that's just at work, right? But reality is that it's anywhere I go and anywhere where I know people, and those of us who do this work, in different places, I think had those experiences ongoingly. So I think that it's about giving voice to the experiences of Black folks, but you can't do that without elevating them in their position. Yeah, you can hire researchers to come out and sort of collect information and put things in a book and put it back out there, but it doesn't help the community, right? It doesn't help us to sort of have a better understanding. I also think that, and I'll just sort of say this so that I can go on a tangent with this, I think that it's about decolonizing the way that we've done everything, right? And so starting with research, I think that if we only have one way to validate what's real or what's healthy and what's not, and it's all sort of from this Eurocentric lens, then that's already a problem. So we have to start asking the question, are there other ways? And I'll just say this, my dissertation, I don't talk about it because the whole academic thing is a whole other conversation, but my dissertation was specifically about what Black folks were doing well, because there's been enough reported on what we haven't been doing well. So much so that I thought that I was going to get HIV just because I was Black, right? I that was ingrained in me. And so, and of course, heart disease and anything else you name, right? Like I'm just waiting. I just turned 40. So I'm like, okay, what's next? Like, what's coming now? And that should not be the quality of life, right? That should not be the experience that I have. I don't know if America knows that. When I come to work and I'm being nice and people say I'm about to get in trouble. But I'm a nice guy and easy to get along with. I don't cause a lot of problems in spaces, right? Which I think before they would say I'm not an agitator, which is not entirely true. I'm just a different kind of agitator. But like, I don't think that people know that those experiences that we have are there or every day are impacting our wellness, right? And that we have to mask some of that just to take care of our children and our families and each other, right? And we have to prioritize, because if you have Black trans folks dying in the street, if you have Black gay men acquiring HIV, if you have all these other things happening, then you have to put your own stuff to the side because you're just lucky, to be alive. So understanding the experience, I think it's about being a part of it, right? Allowing for there to be opportunities to really hear Black folks communicate what they feel, what they experience in those spaces, and particularly in the organizations they serve. This is with clients and the folks that work there. I think that both are important. So deepening that experience means actually listening and not just performatively listening.
That's good. And while you hit that vein, let me give a shout out to 3 Black researchers, because folks will say, well, we don't know where to find them. So one is Dr. Tonya Poteet, who I absolutely love and adore, Dr. Miranda Hill, who you may not have heard of yet, but you will. And another is Dr. Kimberly Parker out of Texas. 3 Black women who I hugely admire, who are doing amazing things as far as research goes. So we can no longer say, future Dr. Micah Everett, that Black researchers don't exist and Black evaluators don't exist. We've got to create, and you said it earlier, we've got to disband the systems that exist, and create new systems that work for all of us.
So, and I'll just say this, they exist, right? And we have more and more folks who are getting these degrees. And what I will say is that we are still valuing the system in which they're coming from, right? Which is like whiteness is still the standard for what's considered well or right or any of those things. And I would like to have an experience where the option for my education is not just coming from this one space or this one way of knowing, right? That it's actually coming from a place that feels more familiar to me, that feels more familiar to my experience, that's more action-based, and that's validated by the people that I love and that I see all the time. So for me, it's, get that stuff, and now we all got to come together and then create something for ourselves and decide what the standards are and not live up to somebody else's.
#Black Agency. Okay.
How about that? Yes. And also shout out to Dr. Tatiana Moten in Chicago, who just got her confirmation this week. So shout out to her. Representative Cannon, we want to hear more from you as well. I would be interested to hear from both of you, but first, Representative Cannon, what does it mean to be Black?
I was just talking with some of my church members yesterday. I'm a part of Ebenezer Baptist Church, which is known as America's Freedom Church. It is the church where Dr. Martin Luther King Jr. preached, where his mother was shot in the church, where Daddy King preached, where now Senator Warnock is the pastor, where there are so many different civil rights leaders who have so many stories to share. And when I heard one of them yesterday sharing a story, they started it off, and I thought that it was going to be about the past. I thought it was going to be in the 60s, in the 70s, and they kept on sharing, and eventually they helped us realize that they were talking about the incident with George Floyd. But the way that they told the story helped me realize the similarities between the things that I've heard in the past and what's actually going on in the present. So the Black experience, because I am Black, I am willing to say it has been traumatic. And because I'm in therapy and I know that I need to be able to name it. But from those different levels of trauma that we've experienced, we have to realize that our storytelling has been co-opted in some spaces. There have been times when we have passed the torch on to someone else thinking that they might be powerful enough to share our story with authenticity, and they did not. And then we actually might have set our community back by not just going up there with our accent, with our locks, with our cadence, with our body movements, and sharing how we really felt. So as a part of the Black community, I'm from, just Georgia Black, as deep as it can go. And so, sharing from that perspective, there are still reasons why I, as a lawmaker, advocate for not just us to look at the organizations in Metro Atlanta and see how we can resource them, but also to go into public health testing protocols and to figure out what within those 400 pages needs to change. Because even if there is an agency in Atlanta who might be doing it for the culture and might just have a few things that they could tweak here or there, imagine what it's like back in my hometown where the providers don't look like us, are unwilling to engage with our communities, and actually start to do things to push us away from their offices, like charging more or doing, late charges or, closing between at 5 o'clock when people are still getting off of work. We need to be able to systematically look at the standardization of care in places like Georgia, Mississippi, Alabama, so that eventually we can get to a place where people can share what it's like to be a Black person affected by or living with HIV with their provider in real time, so that they can then get the services that they need. But just to think that we can skip all these steps, it don't go down like that. In fact, it goes the opposite direction. People won't come back. People might have that initial consult and feel it in their spirit and be like, I don't know what it was about that provider. Well, baby, it was probably one of your ancestors speaking through you, saying what they had experienced back there. I mean, this is deep. Even if it's not religious, it's spiritual. So I'm hopeful that we'll continue to see people speak out and tell stories in ways that show the culture and bring our Black experience to the table, whatever that means.
That's what I call drops mic. Okay? You ate that for me. You ate all of that. Michael, do you want to add some input?
No, hell no. I'm not following that. I know when something's been said.
So since I'm the shout out queen tonight, let me also give a shout out to Yolo Akili in California, the founder of Being, which is the Black, I want to make sure that I say it right, so I wrote it down so I wouldn't say it wrong. Emotional and Mental Health Collective. Black mental health matters also, and it's important. We often, a number of us have read that having an HIV diagnosed. So being diagnosed with HIV is akin to being diagnosed with post-traumatic stress syndrome, post-traumatic stress syndrome. And so it's important that those of us who have privilege and those of us who have access, for folks who need mental health, that they will seek and have access to everything that they need to be healthy and whole, because mental health certainly is a part of HIV care for those who need it. Thank you for bringing that into the conversation, Representative Cannon.
We talked about a lot of strategies. We talked about Black agency from different perspectives. We talked about Black agency within our own communities. We also talked about establishing Black agency in a place where Blackness does not exist. So when we think about strategies like that, and when we think about ending the HIV epidemic through preventing HIV, the treatment of HIV, diagnosing HIV, and responding to HIV within our communities, what are some things, how can we integrate these two thoughts into one to really see a change in ending the HIV epidemic for Black people in America?
This is the intersectionality, this conversation, this is the reproductive justice that we are talking about. And I was living for when you said a messy way to share the message. It's so many messy messages out here. So not only do we need more Cannons, we need more Coopers, we need more Chris's. Yes. We need all the C's we can get out here, okay? But I did wanna just, put in the language of reproductive justice to this process of EHE, because what reproductive justice is pillared around is having families, deciding not to grow your families, having safe communities to grow your communities, and also having bodily autonomy. So broadening the conversation from the group of feminists, whether they are Black queer feminists or just regular old feminists, to actually including folks who work at MARTA, which is our, transportation center here in Georgia, for people to understand that if you don't have the transportation to get to where you need to go, it's less likely that you are going to get there. And if you do, when you show up, you've already been through so much that you just might not get that message. It might be a messy message for you. So I really feel like reproductive justice is the answer for it all in many cases. And I really want to uplift organizations like Sister Song and Sister Love, which is global, honey. Dazon Dixon Diallo has taken us from here to South Africa and everywhere in between, creating HIV centers that bring the cultures, not just the Black ones from America, but also of the diaspora, to say, this is how, whether or not you are, wrapping yourself in your garb and in your clothing, and you feel regal and you are looked at as a pillar in your community. If you are in some way disrobed or have violence come upon you, hold up, not just the groups that are with you who know you from your community need to stand up and rally around you, but also RJ leaders from around the world should realize this as an affront to our collective justice. So we have some ways to go with this process, and we're definitely going to keep engaging as it relates to my office as the Black Caucus. And then I also serve as the secretary for about 78 legislators here, serving 4.2 million Georgians. So it's about to be on and popping, and we really just can't wait for people's reproductive justice to come forth, these reproductive oppressions to get back in their closet, go back where they came from, and just never, ever surface ever again.
Yes, all of that. I should have gotten my Snap fan that I bought from Raquel the other day, because yes, so much power. And shout out to Lisa Diane White over at Sister Love as well, and the entire team for doing an amazing job of centering Black women's wellness in the fight against HIV. Absolutely amazing work. So we're gonna get ready to close now, aren't we, Chris?
Yes, we are.
As we do, a reminder, the 4 pillars of the ending the HIV epidemic are prevention, treatment, diagnosis, and response. So as we close out, first Representative Cannon and then Michael. Can you tell us a little bit about how we can implement the 4 pillars in a way that directly impacts the community that we all are part of, and that's the Black community?
I've got to say, I love 2 of the pillars because it's where I feel like I live every day and I try to take stigma out of. So maybe I can, grab 2 and maybe you can grab 2. We'll see. You'll do what you need to do because this is about you. It's not about me. Okay, so prevention. Prevention for me is so important because I do truly believe that people are able to do prevention in ways that are culturally relevant if they are given resourcing. So it can't be necessarily always a prevention situation where it is only a billboard or it is only a event where you have to pay $25 to get in and there might be drinks happening and it might be sponsored by someone and then the drinks have to stop and then they can talk and then the drinks can start again. It helps to get people flowing, I believe, but I'm hopeful that we'll see our faces more well reflected in the prevention process without it seeming as though if you don't prevent, then your life is not going to be as good as it can be. But instead, if you can prevent, you can help prevent other individuals as well, as if it's more of like a web of responsibility instead of it being this life-altering thing that you would never be able to reverse from. I really hope that we can reclaim this language around prevention, and I really want to be a part of it. The second, of course, is diagnosis that I feel really strongly about. I have been heartbroken to hear people come to my office and tell me the stigmatizing language that has been used by providers when they have received their diagnosis, or where they were, that maybe the curtain wasn't pulled back, or maybe another provider just hopped in real quick to have a kiki, to say, oh, I'm going on my break, I'll see you later. And this is a moment where you deserve full attention. So I am hopeful that in this EHE process, as we talk about diagnosis, we talk about what it means to really care for someone in a moment where you see that their eyes are no longer connecting with you. You can see that their chest might be going up and down. You can imagine that their heart rate is going up and down, or their blood pressure is changing. Why don't we have some essential oils around? Can we, add something that does aromatherapy that immediately attacks those stress indicators? Can you have something that is vibrating, or a fidgeter, something that people can really engage with in that moment of diagnosis? I beg and I argue that we can and we will.
Wow, thank you. That made me think about a bunch of different things, and I'll sort of narrow it down to sort of these 2 things. And I kind of have a thought about the 4 pillars. One, prevention is about strategy, right? And there are tons of strategies. That's what all this education is about. You need to figure out the one that works for you personally, and then the one that aligns for your program, and the one that aligns for your organization, and put those things together. Treatment is about, is necessary. I think that we lose energy in the treatment department. It's like we sort of drop the same kind of energy that we put with prevention. Everybody, I think prevention feels easy for everybody in a lot of ways, and there's still something really sexy about it, and treatment scares people. But the reality is that it's necessary, and we have to keep the same energy in treatment as we do in prevention. I think diagnosis is about knowledge, and we already know that knowledge is about power. So the fear around knowing, we get it. That's always been there, but we've got to start breaking that down because we've got too many steps after knowing, right? In order to sort of get this thing under control. And then responses are call to action. It's about being responsive. I remember one of the best things somebody's ever said to me is that you were really a responsive trainer. And then I just worked on always being a responsive trainer because that's what I could control, right? If I could get you stuff, if you wanted resources, and no matter what it took, that's what I wanted to do. That I wanted to be good for the people. And I feel like that it's the same way here, right? Once we get people, once they're diagnosed, once they trust us, let's keep them going through this process. So it's important to recognize all that. The last part that I'll say is that the pillars also represent the opportunities for partnership and non-traditional partnership. And I think Representative Cannon said this, or alluded to this for sure. for me, non-traditional partnerships could be stuff like MARTA, could be like transportation systems and those places. We should always be looking at places we don't expect to be a help, because they could absolutely be a help. But it's also those places that we when you sit back and you think we should know better. So I thought about this. My mother, who had been in rehab for a large part of my life, my growing up, right, as part of the 90s crack epidemic. And I remember thinking, I didn't get tested for HIV until I was, much older. But as much as we had been in and out of rehab just with her, there could have been so many opportunities to make those connections, right? There was no education for me as her son going through that process with her. And they just sort of focused on her. But when you think about it, all of these women who have children and these fathers' children, right? There's real opportunities there to educate the family in a way to talk about health from a different perspective, since we're already talking about drug use, right? So what are those other traditional and non-traditional partnerships that exist? And what would it look like for my mother to have taken me to get my first HIV test, if that's what the rehab helped her to do? Wouldn't that have built efficacy and confidence in her to be a parent, which is also one of the things that was triggering for her drug use, right? So like all these things can work together. I love the idea that it's about everything that can help alleviate stress. Everything matters, the little things, what something smells like. When I wake up in the morning, I light my instant. If I don't, I'm gonna have a really poor day, right? I have to drink my water. I have to do these things. I have to work out and run, because I recognize as I get older how important those things are to me. And health are not just about your heart and the things that we know. It's about those things specifically to you that get you to be your best self. And it may not look like medicine, right? It may be medicine to you, but it may not look like medicine to other folks. So that's that. And the last piece is the opportunities that get missed for Black folks. This is a message for Black folks. When we talk about health and getting to health equity, here is what I believe the process is, and it's simple and not simple at the same time. We start with consciousness. People have to be aware of something to be able to do something about it. You move from consciousness to literacy. Getting people to read something is one thing. Getting to understand what they're reading is a whole other process. You can spend years figuring that out. I think the Bible was one of those things for me. No matter how many times I read it as a kid, I was like, what are they talking about, right? Because they didn't give me the capacity to break those things down. And then efficacy. Once you understand it, can you do the thing you need to do to be better, right? And then once you do that, then you're ready to promote, because only people promote things when they feel good about their ability to do it. That's why when folks learn a new religion or get saved or whatever the thing is, they're ready to share that good news with somebody else because they feel like they've mastered something inside of that. But that process works for learning across the board. And I feel like when we talk about health and Black folks and communities of color and HIV, we miss opportunities in between consciousness and literacy, and we get messy with the messages in between efficacy and promotion so that it all gets mixed up. But if we align this and give folks what they need, resource them to do what they can absolutely do and will do anyway, if we build up their skills, they will be their own solution. And this is really, this should be the key here, that everybody should be a part of the solution and we can be our own solution. We don't have to wait for someone else to save us. So I'll just leave it at that.
All right. With that being said, I would like to thank Representative Park Cannon and Dr. Michael T. Everett for being here, for helping us to facilitate such an authentic, raw, and unscripted conversation. It's definitely been a moment of wow. And with it being a moment of wow, I'm gonna leave you with some words of wisdom. W-O-W, like what I did right there, okay? Okay. All right, so remember, we just gave you a little taste of our Black agency. You saw it in real life. So now you can go out and figure out what your Black agency is and know that you have the power to make change. I want you to communicate, collaborate, and control what happens to you within your life. Until I see you again, this has been What Does It Take to End It? Wishing you love, light, peace, and hope.